My name is Dr. Sarwar Chaudhry. I'm a pulmonologist. Today we're going to talk about sarcoidosis. First, we will talk about what is sarcoidosis, what are the symptoms of sarcoidosis, what is the cause behind sarcoidosis, how we diagnose, and different tests that we need to perform, and finally the treatment and prognosis. So, sarcoidosis, in terms of its definition, is inflammatory disorder. It can affect any part of the body, but more commonly it involves the lungs and form granuloma, which is basically a group of cells causing inflammation. And these granulomas can form in multiple places in the lungs or any other part of the body, depending on the involvement. So when it happens, it can cause a variety of symptoms. In some patients, a majority of other patients, there are no symptoms if it involves a small part of the organ or the lymph nodes. If it involves the major organs or majority of it, the patients may present with various symptoms. In case of lungs, the most common symptoms are cough, which is generally dry, and breathlessness. There could be associated chest pain, chest tightness, or other symptoms. If other organs are involved, like brain, heart, or kidney, or liver, there may be associated symptoms related to the organ involvement. Now, talking about the pathogenesis or the cause of sarcoidosis, it's an idiopathic disease, meaning we don't know what causes sarcoidosis. It may be a reaction to some sort of an infection or exposure to some sort of allergen, but these are all theories and not proven. In terms of diagnosis, patients who present with minimal symptoms or have some symptoms, they will need imaging studies of the lungs, which generally will start with chest x-ray or the CT scan of the lungs. If other organs are also involved, we may need to do other dedicated imaging. We need to do a full pulmonary function test to determine the lung capacities and how much functional capacity of the lung is remaining or lost due to the disease, which also helps in the long-term prognosis and surveillance. Sometimes these X-ray imaging and history, along with some blood tests, are helpful to make the diagnosis of sarcoidosis. Sometimes we need a tissue diagnosis or biopsy, which we need to do from a site of the involvement, which could be lymph node in the chest, which we can biopsy with endobronchial ultrasound, or if there's a lung involvement, we can do bronchoscopic biopsy or open CT guided biopsy. Generally, is not needed, but open vessel section can be required. So once the diagnosis is confirmed, we move on to the treatment phase. If the patient do not have any particular symptoms, they do not need any treatment either. On the other hand, if the patient has got progressive sarcoidosis causing any organ involvement, those patients do warrant treatment. The treatment consists of a steroid, which we use over many months and sometimes years. If the disease goes into remission, we can stop the steroids and watch it. On the other hand, if disease doesn't go into remission, we may need to use other immunomodulator therapies, which helps reduce the side effects of the steroid in the long run. So prognosis depends on the severity of the disease and its progression. If it goes into regression or resolves, there are no particular long-term consequences. On the other hand, if there is significant joint and organ involvement, there may be long-term consequences, depending on the severity of those ones. In case of lungs, people may get advanced pulmonary fibrosis because of sarcoidosis, and the lung may not work, and they may need lung transplant in the long run if they would qualify. So this is a brief introduction to sarcoidosis. If you would have any questions, you can ask us in the comment section. Thank you.